Good afternoon, everyone. My name is Köves-Dobszai, and my topic is the effect of obesity on the progression and outcome of acute inflammatory diseases. My vision is aiding physicians in risk assessment and decision-making about obese patients, and to be able to do that, our mission is to comprehensively address all factors related to obesity for deeper understanding the way they interact with each other. We have already conducted a meta-analysis on how body mass index correlates with severity and mortality in acute pancreatitis, and as a continuation of our previous work, we took other obesity-related factors into consideration, and now we are investigating the effect of metabolic syndrome on the outcome of AP. In my second project, I am investigating the same exposures, but in this case on the outcome of COVID-19 with the framework of registry analysis. So let me introduce my first project. We are all aware of the dramatic increase in mortality rates when acute pancreatitis became severe. And as obesity rates are increasing, so does the incidence of the different comorbidities related to it. So it is not surprising that the prevalence of metabolic syndrome has also reached 20 to 25% in the Western countries. All of these metabolic syndrome factors were earlier associated with more severe acute pancreatitis outcome and even higher healthcare costs. But these studies were either meta-analysis focusing only one of the factors or cohort studies with a very low sample size. So our aim was to investigate the individual and the synergistic effect of these factors also on acute pancreatitis outcome. Our question was how metabolic syndrome factors affect the outcome of AP, and we were investigating obesity, diabetes, hypertension, and hypertriglyceridemia as exposures to see how they affect mortality, disease severity, and the rate of complications in AP. We have conducted a systematic search in 3 databases, and from almost 20,000 articles, we could include 90 in our final analysis. In our analysis, we have included both prospective and retrospective studies, and there was an overall higher heterogeneity among the included articles, partly because the included articles applied a slightly different methodology when diagnosing metabolic syndrome, and there was a huge difference in the number and type of centers included in the studies. So on the first forest plot, you can see those studies where patients were grouped as having metabolic syndrome or not having metabolic syndrome. So in this case, patients were presented with a multiple of the investigated factors, and we saw that patients with metabolic syndrome have a 40% increased risk for a severe outcome. However, the result was mathematically not significant. And in case of mortality, you can see that 2 of the included studies did find an association between metabolic syndrome and AP, and 2 of them did not. And the reason behind not getting an answer exactly in this case may be the very low number of events in each of the subgroups. Moving on, we investigated the effect of excess body weight, and as you can see, obesity, so a BMI over 30, elevated the risk for severe acute pancreatitis and even mortality, but in case of mortality, the result was not significant. However, besides these primary outcomes, we saw that both overweight and obesity significantly elevates the risk of local complications and even systemic complications throughout the disease course of acute pancreatitis. The next investigated outcome was hypertension, and we saw that patients with malignant hypertension have a significantly increased risk for mortality in AP, where the effect on disease severity was not observed in our analysis. Diabetes was not a significant predictor of these primary outcomes of acute pancreatitis. We could only see a tendency in case of disease severity. However, we saw that diabetes elevated the risk of the need for ICU admission and even renal failure throughout the disease course significantly. Lastly, we investigated hypertriglyceridemia, and we did not only look at patients who presented with a hypertriglyceridemia-induced acute pancreatitis, but involved those patients who presented with an even borderline elevated triglyceride level on admission. And we saw that these patients have a significantly increased risk for a severe acute pancreatitis outcome and seems to be increasing the risk of mortality as well. And besides these outcomes, it was a significant predictor of the need for ICU admission and even necrosis development. So to sum up, with all of the metabolic syndrome factors were somehow associated with a poorer acute pancreatitis outcome, but from the investigated exposures, hypertriglyceridemia seems to be the most important, as it was associated with the most unfavorable outcomes. The strength of our analysis is that this is the first comprehensive meta-analysis in the field, and we analyzed these factors individually also. However, there was a high heterogeneity among the articles, and the sample sizes were very low in the subgroups we could create. Our conclusion is that metabolic syndrome and its components individually worsen the outcome of AP, so these patients require closer monitoring. And considering the high rates of acute pancreatitis recurrence, the lifestyle counseling and education of these patients is also crucially important. And while the link between metabolic syndrome and AP seems to be very clear, gaps in the literature still persist, especially about the causal mechanisms. And recent studies highlighted the effect of inflammation and gut microbiota in the development of both metabolic syndrome and acute pancreatitis, which may offer new therapeutic targets in the future. For this project, we have finalized the manuscript, which is under internal review and will soon to be submitted to the UEG journal. Our next project is investigating the effect of metabolic syndrome on the outcome of COVID-19. COVID-19 is a viral infection with a mortality rate between 3 and 7%, and its clinical spectrum ranges from an asymptomatic infection to even severe pneumonia and multi-organ failure, where comorbidities lead to a more severe outcome and poorer prognosis. And as I earlier mentioned, metabolic syndrome factors are associated with many other diseases as a risk factor. So our aim was to comprehensively analyze the combined and synergistic effect on these components on the outcome of COVID infection. Our question was how metabolic syndrome factors influence the outcome of COVID infection, and the investigated outcomes will be ICU admission, the need for mechanical ventilation, disease severity, and mortality. For this analysis, I am using the coronavirus registry of the CATLAG study group that has the data from more than 1,000 patients from 6 Hungarian and 1 Croatian center. We are still working on collecting some additional data for the final analysis, but we have performed some preliminary analysis from all of the factors, and major outcomes that we could investigate until this point were disease severity and in-hospital mortality. And as you can see, obesity and hypertension are both associated with a more severe disease course, but only hypertension was increasing the risk of mortality. And when looking at diabetes and hypertriglyceridemia, we could see that in all of the cases, the rate of severe disease and even mortality was much higher in the case groups compared to the control groups. So to sum up, with my first project is finalized and only awaits submission, and my second project is expected to be submitted by the end of September this year. Thank you for your attention, and I would like to close my talk with the words of Abraham Lincoln. Things may come to those who wait, but only the things left by those who hustle. Thank you.
Congratulations, Dalma. I would like to invite the audience to ask their questions.
Do you have any data I'm asking about the first project and the effect of diabetes on the course of acute pancreatitis. And do you have any data of different types of diabetes and different level of hemoglobin A1C? So do these parameters may modify your results on the outcome of acute pancreatitis?
All of the patients that were included in the diabetes group had pre-existing type 2 diabetes mellitus, but we do not have data on any other types of diabetes or the ones that were occurring after the acute pancreatitis episode.
Dalma, could you give us an explanation why is AP acting a little bit more worse in the hypertriglyceride population compared to the others? What is the pathomechanism behind it?
Hypertriglyceridemia-induced acute pancreatitis is with the worst outcomes from all of the etiologies, and we could see that even a borderline elevated triglyceride level has not the same deteriorating effect, but some kind of similar effect than the hypertriglyceridemia-induced ones.
Thank you.
But what could be the pathomechanism behind it?
I'm not a medical doctor and I did not look into the details, but I will sure do that because this is absolutely a question that I should be able to answer.
Yeah, so it impairs the microcirculation of the pancreas and probably hypoxemia. Do you have a question?
No. Okay, if no more questions, then thank you again.
Thank you so much.